right. Hi, everyone. Thank you so much for tuning in to our presentation. Today, we are highlighting nurse practitioner career in healthcare. This is one of the many videos that we've got for virtual career exploration series where we highlight a different career path in healthcare every month. So thank you so much for joining us today. We have Jamie Wolf, a nurse practitioner in neurology, here with us to share about her role at ProHealth Care, kind of the career path that she took to get here, and just to kind of dive more into the nurse practitioner role and the education that she had, and again, the career path that she took to get there. So I will turn it over to you, Jamie, to more formally introduce yourself and then dive into your presentation.
Okay, thanks, Ashley. Hi, everybody. As Ashley said, my name is Jamie Wolf, nurse practitioner here at Waukesha Memorial Hospital through ProHealth Care. Here today to talk with you about my role. I kind of have a couple of things set up here as far as how we're going to go through. Today's presentation will have my introduction, my education, kind of a day in the life of what my day looks like, and then we'll wrap up and go to the next kind of any questions or anything like that, how you can contact me. So my formal education and job roles are all listed here. So MSN meaning Master of Science in Nursing, RN meaning Registered Nurse, FNP is Family Nurse Practitioner, and BC means Board Certified. APNP is Advanced Practice Nurse Prescriber. And then I have MSCN, which is pertains to my role here in the neuroscience department, and that's Multiple Sclerosis Certified Nurse. Usually you'll just hear APNP, NP, or advanced practice nurse prescriber or practitioner. All of those are kind of used synonymously no matter what our training was. And we don't like to write all of that alphabet soup behind our names. So many times we'll just say, you'll see sign my name, Jamie Wolf APNP or Jamie Wolf NP. So I've been working here as an NP for about 11 years, and 10 of those years were an RN. Prior to that, I was a certified nursing assistant and nurse intern, and that kind of I'll talk about a little bit more when I go through my education. Reasons why I wanted to, be a nurse and then eventually nurse practitioner. Number one was a family experience that I had. I had an aunt who was a nurse, and I just really, truly respected her, or still respect her. She still works as a nurse, and I really enjoy being able to help people. I enjoy being there for people. I think the science and the art of caring, what I saw my aunt doing is what I wanted to do for others too. So I saw that firsthand through my aunt. She was always like the authority figure. Like we always were like, what, go ask Aunt Brenda what to do. So it was a very personal reason. And then another reason was a school experience, maybe similar to what is offered in class for you guys. And that would be, it was called Health Occupations. And it was really cool because we went through nurses, doctors, physical therapists, pharmacy techs, pharmacists, like pretty much anybody and everybody that has anything to do with healthcare. And, learned about all of that, and really nursing had always stuck out to me. So as far as education, I'll kind of go, how did I get here? And, some of the classes that I ended up having to take. So number one thing, I won't go through all the classes that I ended up taking in high school, but we didn't have back then AP classes or anything like that. But I really highly encourage people, if you can take, your psychology or sociology, chemistry, microbiology, anything that's offered in high school that would be equivalent to a college course, I would really encourage you to do that. If you don't, science classes are a must. I really encourage you to try to get some of those things on board so that when you do get to college, it's not such a shock, and it really kind of sets that stage of base of knowledge for you. Then you proceed on to college courses. The biggest thing that I can say about that is really when you're meeting up with your kind of your counselors and starting to apply for schools, really getting to figure out what that college coursework looks like, and kind of meeting up and seeing, what did I already do? What do I need? And trying to lay that out. And that's what those counselors are there for too. So And then really important, but not really an entire piece of the education, but it really was helpful, was starting to work in the field. So as I had stated previously, I worked as a certified nursing assistant, and then I had the opportunity to be a nurse intern through our medical floor that I worked on. So it was really neat. They paired you up with an RN and you got to work in that role and really kind of apply that knowledge as you learned. So that's kind of that brief overview. I'll get into more of the college courses here in the next slide. So I went back to college 3 times and just kept getting another degree or adding on to that education, but always as a nurse and nurse practitioner. So I started out at a local technical school, which is Waukesha County Technical College. And I obtained at the end of that time was an associate degree in nursing. So that is comprised of 2 years of clinical work. So you're in maybe a nursing home or a hospital, sometimes in the clinics and whatnot, but 2 years of clinical work. So usually about 2 to 3 days a week, 8 hours a day, you're there. And it's usually about a year of prerequisites before that happens. So that's why I was talking about if you can get any of those AP courses in, that year of prerequisites really goes down while you're on that waiting list to get into your clinical work. So even during the clinical work in which you're doing hands-on care, you're with your instructors and other students, usually a group of like 5 to 6 students. You really you have to be writing papers in between time and stuff like that too. So it's not just that hands-on work. So that's 2 full years of that. Once you graduate with your associate's degree, after that, I took the State Board of Wisconsin certification. So this is what people might refer to as like your RN boards or something like that. So that has to be the bare minimum testing that a person has to pass in order to have a license as an RN in the state of Wisconsin. So after I did that, I started working here at Waukesha then as an RN after my CNA and nurse internship. So started working on our medical floor, and then a few years later, I decided to go back for my bachelor's degree. And it was a really neat opportunity for me because Concordia University actually came to the hospital 2 to 3 nights a week, or 1 to 2 nights a week, I should say. And we would do probably about 4 to 6 hours of class a night, and we would get a semester done in anywhere between 4 to 8 weeks. So it was very intense and very fast, but it was really neat because I was working as an RN already. So I really had great clinical experience and then could add into that kind of more well-rounded education as a bachelor's prepared nurse, writing a lot of papers, doing some community work and things like that. So that took me about 2.5 years to complete, just because of the time where we joined in with the system. And there's no need to repeat the board certification after that. Once you take that board certification as an RN, you're an RN, whether you're an associate's degree in nursing or a bachelor's degree in nursing. So that was pretty cool that you can earn that RN wage and try to go to school and pay for everything too. So after I finished my bachelor's degree, I took maybe about 6 months off and decided why not keep going. So I went back. So you'll see this, you'll hear this from a lot of different people where they did, right away did the bachelor's and then went right into their master's degree. Some people wait several years. Some people, wait 10 years, 20 years, and then go back. So the cool thing about nursing is you can do it at your own pace. So I went back to Concordia because they had a lot of my transcripts and credits, and I really liked their approach to education. So that was my MSN, my Master's of Science in Nursing. But then you have to, on top of the Master's of Science in Nursing, pick some type of degree. So mine was family practice. So you could there was at the time gerontology, which would be the care of the elderly folks. There was adult medicine, so you never see kids. So I like taking care of kids and I like taking care of older people. So from newborn all the way out to, our grandparents, I'm certified to be able to take care of them. So I liked that approach because then it also, I thought, would keep me pretty marketable for anything else that I wanted to try in the future. So That was another 2.5 years. Again, I kind of joined at the end of a different semester. So, but it was way more intense than doing my bachelor's degree. This included 600 hours of clinical practice total. And 600 hours doesn't sound like a ton over 2 years, but you had to get 200 hours per semester. So 200 hours per semester, I was in clinics. I was in, that would be pretty much about it, but specializing in different things. So 100 hours of that 600 had to be with pediatrics, 100 had to be dedicated to just women's health, and then the rest of the 400 was anywhere across the family practice. So family practice is more of, like your regular doctor that you go to checking for, cancers, diabetes, your regular health exams and stuff like that. So I did that with several different providers over that time. So, but in addition to that clinical practice, you have classroom time too. So you're writing papers and going to clinical. And if you are like me, I ended up working the whole time too. So it was very, very challenging. I would suggest working part-time at least if you're going to do that. But I don't regret it at all. I really had a great experience. So after that, after you fulfill your 600 hours of clinical practice, all of your classroom work is passed. You do a master's thesis, which is your big final paper. You are okay, you're cleared then to take the national board certification. So there's a couple of different certifying bodies. My own personal choice was to go through the American Nurses Credentialing Center, which we all know as the ANCC. So that is about a 4-hour test, which is very intimidating to hear that. 4 hours is going to, make or break your 2.5 years of all your hard work. So, but took some preparatory courses. So there was about a week before that, or a week of classes that you can take through the ANCC to prepare you to take this test. So it's a really good opportunity to have that too on board, but really felt very well prepared with the education that I had. So after you pass that board, then you can become licensed through the state of Wisconsin. So I have to have a license to be an NP, and then I always have to keep up my license as an RN as well, even though I'm not really practicing as an RN anymore. In addition to that, the DEA certification test, so that's the Drug Enforcement Agency. If I want to prescribe anything that would be considered, like a pain medication or something along those lines, we have to know that we are being responsible prescribers. And so that's another test that you have to take after that. Yeah. So just when you think you're done, you're not. So as far as the certifications, I did the family practice certification, but then I also hold that multiple sclerosis certification because when I went back for my nurse practitioner for my master's in science of nursing, for that degree, I was already working in the Neurologic, our neuroscience institute. So I wanted to make sure that I kept that up too. So that is a separate certification, a separate test that I had to do in order to be certified to take care of the patient with MS. Both of those, the certifications, once you take them, you have to maintain them. So that continuing education is required. We usually refer to that as CMEs or continuing medical education. That can be done through, writing a research study, mentoring new students coming out of school or while they're in their clinicals. Your practice hours apply to that, and going to some professional conferences. I really like to go to the conferences because it's like a great, 2 to 3 day way of really boosting your education and a great way to network with other people in your field of specialty. So, because sometimes those specialty areas can get pretty small. So I have 2 separate certifications. So every 5 years I have to renew that. So I have to keep track of all of the things that I do over those 5 years to keep my certification current. I do have a link on here of some of the common nursing certifications. This list is huge, so I just put the link on there if you're able to click on that at any point in time. So some of the certifications that are really known, though, to the nurse practitioner would be some of the things that people that I've worked with in the past, the geriatrics, so those that are working with more elderly Neuroscience, I have a couple of colleagues that have separate neuro certifications. Definitely when I worked up on our medical floor, we had nurses that held that medical specialty too. So a lot of our ER nurses have emergency medicine certifications. So it's pretty neat what you can all do. Kind of the sky's the limit on that one. Um, and proceeding on kind of a day in the life of what I'm usually doing. So my schedule right now is usually Monday through Thursday. I usually do 10-hour days. I'll log in sometimes on Fridays if I know that my team members are really overwhelmed or busy and help out and stuff like that. When I worked as an RN, I did 3 12-hour days a week, which was really cool because then you only had 3 days a week that you were working. So, but currently I'm in a clinic setting, so it's a Monday through Thursday right now. I do take call once in a while, but our call is a little bit different than what people think. I'm not getting calls from the emergency department or anything. We have a separate neurohospitalist for that. So that's a neurologist that specializes in only seeing people while they're in the hospital or in the ER. So I'm just getting the calls from some of our patients that are known to us in the clinic to answer a question that maybe can't wait until Monday, or if I do think that, something is definitely different or going on, I guide them to the emergency department. So the call is really not all that bad. So, and again, it's only a few times per year. My basic patients are going to be mostly MS or multiple sclerosis and stroke. So MS is a disease that's diagnosed usually between the ages of 20 and 40. But those patients live a very long time. So I have people in their, 70s, 80s, and maybe even a couple in their 90s. So I do have people all the way up. It's mostly adults, though, anybody over the age of 18. Stroke, while that's mostly older patients, we do sometimes see people that are younger that have strokes, unfortunately, too. And so that's going to be anybody maybe from their, 40s all the way up into their 90s and 100s. So I kind of get a little bit of everything throughout the day, which is good. And then I have a very small population of patients that have baclofen pumps. And these pumps are something that the neurosurgeons will place in these patients and to deliver medication to the brain and spinal cord. And so I'm the one that fills those and maintains those. So I have a very few patients with that, but that's basically kind of my patients. But I end up seeing people with migraines that maybe have MS or migraines after a stroke or something like that. So I have to have a pretty broad knowledge of all of the different neurological conditions that people can have. So colleagues and coworkers. And when I say everyone, I'm not kidding, it's everyone. So I'm really on a daily basis talking to a lot of nurses. I'm talking to our inpatient and outpatient nurses, so the nurses that are working in clinics. I'm talking with I have what we call a collaborating provider. So that's a neurologist that works with me, and we bounce things off of each other and kind of review patient cases with each other to make sure that we're doing the best thing for our patients that we possibly can. I'm talking with the pharmacists all the time. Where I'm talking with people from facilities. So those are, the light bulb goes out in your office, you got to talk to them, people definitely from radiology. I do a lot of MRIs on my patients' brains and spinal cords. So I'm definitely talking with the radiologist if I have a question on an image, that kind of thing. There's a lot of scheduling staff in the front of the office. So really working with them to troubleshoot to get people in sooner or open up a new slot for a patient to get in and whatnot. So it really ranges from everybody from medical assistants, nurses, doctors. So everybody underneath this roof is my colleagues. So that's the way I look at it anyway. So some of the other things, so my main responsibilities in that 10-hour day, a lot of times I'm seeing patients in clinics. So that's like your regular doctor's visit. Come in, we talk about your medications, check your blood pressure and stuff like that. Talk about what's your big concern. It's usually a follow-up on how you've been doing over the last 6 months, 3 months or so. So that's the bulk of my responsibility. But then will go to our infusion center, which is here in the hospital. If I have some patients, some of the medications that I give have to be given over several hours. So sometimes I'll go up there and see patients there. And then I'm also like entering in all the orders for that and making sure people have their lab work done, their MRIs done, whatnot. Um, we do have, as I talked about a little bit before, that neuro hospitalist, so that neurologist that sees people only in the hospital. But when you're in my role and in some of the other roles in healthcare, you really develop a long-standing relationship with your patients. So if they get admitted to the hospital, we really want to be there for them, and they'll request sometimes to see them. So I'll round on them like a doctor would round on the patients, go up there, see them, review the chart and things like that. So I'll do that too sometimes. Other pieces of it are going to be clinic coordination. So myself, the nurses, and the physician that I work with, I kind of make sure that we're organized if we need to meet with anybody. If there's any issues with our the function of our own clinic, to make sure that we're all kind of on the same page and we're troubleshooting together. Patient advice. I'm often going into, maybe some of you know already, you can send a message to your physician through your chart and they will answer your question within a day or so. So a lot of times I'm having to do that. So between patient visits, I'm kind of filling in the blanks with a lot of these other things, or I come in early or I stay a little bit later after clinic to do that. Of course, signing medication refills. And then part of that clinic coordination piece, the science and medication community. So that's like what we would call like the pharmaceutical community. So they have a medical side of things, and those folks come in and talk with us about any updates on their particular medication, any safety issues, those kinds of things. So it's very, very important for us to be updated on anything that's new, whether it's better or worse, regarding a medication, so we keep our patients safe. The rest of the pharmaceutical community will be very helpful for our nurses because they're the ones that help our patients many times find, like support for co-payment assistance to pay for their medications and stuff like that. So it's really important for us to stay in touch with the pharmaceutical company too. So, and then MRIs, as I talked about before, I do talk to the radiologist, but we look at our own MRIs too and make sure, because that's a marker of how well our patients may be doing with regard to multiple sclerosis or a stroke, because that's the preferred kind of x-ray or whatnot that we would like to do. So I'm looking at those MRIs, getting back to patients if I'm not going to be seeing them soon, to let them know how things look. And then of course I'm always reviewing lab work, because every medication that anybody takes, whether it's MS or not, can affect your liver or kidneys or blood count or something. So that is kind of it in a nutshell, but there's a lot of things that go on that we're trying to take care of throughout the day, not just seeing patients in the clinic. So moving on to my favorite part of my job is definitely helping people understand their condition or disease and what they can do about it. We really want to partner together because it's more than just taking a medication to treat the patient. Sometimes we are looking at, helping them to quit smoking, helping them to learn about nutrition so that they can lower their cholesterol, or learning how to manage their stress and helping them find, a way to exercise or going to therapy or something like that. But really helping people to understand, because when you don't know what's happening, it's very scary because your mind can go to places that it shouldn't go to. But I really enjoy letting people know that we're going to do this together and what is happening to their body and why they feel the way they do. So that is definitely the favorite part of my job. Most difficult is not having a solution or some further options for treatment. We are human, the patient is human. So sometimes things are not always the way we want them to be. So unfortunately that can happen, but there's still always something there for us to do to be there for our patient and make sure that we support them no matter what is happening during our care with them. So some of the equipment that I use throughout the day, these are pretty much a summary of the things that I use. Stethoscope, a lot of people know what that is. We see that hanging around the doctor or nurse's neck quite often. Reflex hammer, neurotips, tuning fork, and ophthalmoscope. And I have some pictures of some of these things because not everybody sees all of these things unless you go to a neurology office. So the upper left-hand corner would be the reflex hammer. So you may have seen this at your regular doctor's office. They tap on the knees sometimes to check that. We check a little bit more. We're checking arms and ankles and other things in neurology. Gives us a really great insight as to what's going on in the brain and spinal cord and where a problem may lie. The apparatus to the right upper corner is the tuning fork. And that is a really great indicator of how well a person can feel sensation. So if they have poor sensation, they can't feel this, it's like a vibration that you feel. And we put it on like an ankle bone or a toe or a foot, hand. And if a person can't feel it, it really gives us some good information where something might be affected, again, through the brain and spinal cord with regard to sensation. On the bottom left-hand corner, these are called neurotips. And so underneath the little rounded end of that, we take that off, and that's actually a little pointy needle. So sometimes we'll see if a person can tell the difference between dull and sharp, and that gives us a little bit more insight also into some of the sensation that they can feel. And then the bottom right is called an ophthalmoscope, and I use that in particular with my patients that have had strokes and MS because I'm looking at the back of the eye. So the back of the eye is called the fundus, and I can sometimes see inflammation back there if a person has had some bleeding or swelling, or if they've had some inflammation on the nerve that goes to the eye. I can see that when I look at the back of the eye with the ophthalmoscope. So is with regard to the stethoscope, of course, I'm listening to the heart, but sometimes for my stroke patients, I'm listening to the arteries in the neck too, to maybe give me some information on where their stroke may have come from. So but those are the four big things that I typically will use throughout the day. And then the baclofen pump that I had talked about briefly before. Again, this is a pretty small part of my job, but it's pretty neat to be able to treat our patients with this. So this little kind of round, I call it like a little hockey puck with a gnome hat on top. That is the actual pump that goes inside of a person's abdomen. It's kind of off to the side underneath the skin. And what happens is there's a tube that brings some medication underneath the skin and goes to the spinal cord in the brain to deliver medication there. And then so the tablet and then the other apparatus that you see there, that's what I use to program that pump. So I can tell the pump how much medication to give the patient, when to give it to them, all of that stuff. So it's kind of neat to be able to help people that have those a lot of muscle tightness. And some of those patients might be patients with MS, patients with stroke, but then sometimes cerebral palsy, spinal cord injury, or a brain injury. So that's a really useful thing for our patients to have. And so there's a little tiny hole in the middle of the pump itself, and that's where I would poke the patient with a needle every 6 months, every 3 to 6, usually, to take out the old medication, give them new medication, and make sure that the pump is programmed appropriately. So not always, it's not a lot of clinics have that, but it's kind of a neat thing that we're able to do and breaks up the day a little bit. So kind of wrapping some of the, things up. You've heard a lot about me, my education and things like that, but some of the things you really can't learn in school, you can't learn, by reading a book. You really have to do it kind of on the job. And so what I can't stress enough is a history of hands-on care. So I really encourage people, if they're considering a job in nursing, as a nurse practitioner, as a, physician's assistant, even if you want to go to medical school, get something where you have hands-on care. So working as a CNA, working as a personal care assistant, working in an adult daycare, or if you're interested in working with kids, work in the areas that, because if you're not used to touching people or helping them stand, or, having to help them dress or bathe or something along those lines, you're going to struggle. It'll really keep you more comfortable because these patients are trusting you. So you want to be confident in what you're doing. So that hands-on care, I cannot stress that enough. Listening skills, if you don't hear what your patient is telling you, you are not going to be able to help them. So many of my patients will hear me, say, do you mind if I take some notes? I'm writing things down. And then when we get to a certain point, you want to repeat that back to them and kind of mirror what they said to you so they know what you're saying to them. People will know if you're not listening to them. So it's so important, not only out of the respect and compassion for your patient, but to really be able to develop that good plan of care, that you're listening to what their symptoms are and what their concerns are for the day. So listening skills are a must. Problem solving. So this is a daily occurrence, hourly occurrence. So many things such as like not being able to find medication, we'll have to really dig in deep and think outside of the box for our patients to get them the right medications at a good cost for them. So dipping into all of our resources, such as what we call copay assistance programs, or reaching out to the MS Society to say, do we have any resources to help these people get what they need? So really important for that, or people that have transportation problems, or problems remembering medications at home, like little things like pill boxes, and just kind of figuring out what's going on with the patient so that we can jump in and do that. Adaptability. There is no such thing as anything steady in the nursing field or in healthcare for that matter. So you really always want to you're going to hear about a new policy, or a new schedule, or a new medication or something, or a new way to do something. So you really have to be adaptable in what you're doing on a daily basis. And we don't do things because that's the way we've always done it. We're always kind of looking at it and bringing in that problem solving so we can adapt. So it all kind of goes together. And then, talking about the certifications that I maintain, and the recertifications needed, all of that's the continuing medical education. You have to have a desire for lifelong learning. If you do not want to continue to learn, then you probably don't want to think about a career in nursing, or or the healthcare field in general, just because you have to keep up. There's always new research. There's always a new medication. There's always something new happening. Technology changes so quickly, and so does our capability then to care for people. So you really have to be willing and open to learn something new every single day. So at least one thing, because it happens to me every single day. So, and then just kind of, why I love working here at ProHealth. I have had so many great opportunities, in particular, our community opportunities. Here at ProHealth, we really take, I think, some ownership on the health of our community. So it's really, really important for us to give back to the community. So you'll see like cancer walks, and, we're really involved in, things like United Way and whatnot. I am really involved with the local MS Society. I volunteer at a lot of their walks. I'm on a couple of different committees that are, we're putting on dances for people that might have some physical, handicaps and whatnot. So just a lot of the things that we're able to do to give back to the community. And I always feel like everything that I've ever wanted to do has always been supported by my managers and directors and whatnot. So going back to school, trying to learn something new, trying to maybe say, let's do something different. It's all possible. And I think you're really valued and listened to when you're working here. So I've been here now going on 22 years. So I really can't say anything, bad about ProHealth. I love working here. So you should come. And so thank you very much for your time and attention. I do appreciate it. If you ever have any questions, feel free to contact me. That's my work email. Feel free to reach out anytime if you're having some questions about going through nursing school, how you'd ever shadow somebody. I can point you in the right direction. And I do appreciate your time and attention.
Thanks, Jamie. And thank you if you did tune in today. We appreciate it. And again, if you have questions, you can always reach out. Other than that, we hope to see you next time. Take care.